Okay, we're doing a typical example of plantar fasciitis, and what we have is a 44-year-old male that is 190 pounds. He's a banker, hikes and golfs. He's developed left heel pain that is worse in the morning when he gets out of bed after sitting for long periods, which is very typical of plantar fasciitis. He is tender on palpation over the medial calcaneal tubercle, also over the proximal area of the medial longitudinal arch. He stands in calcaneal valgum with a slight genu valgum as well, has low arches bilaterally, and remains pronated as he's walking. He also has a mild rear foot varus deformity, which was noted on assessment. So, in order to build orthotics for this fella, I would go to this page, which you should have seen on the general overview how to get here. It's pretty straightforward. You need your account number. This is not a real account number. He's a pronator, so we will use a regular shell. If he weighed more, he's 190. If he weighed over 225, we'd want a reinforced shell, and if he had a wide foot, we would use a wide shell. Top covers. He's a banker, so we don't want to make too much bulk. If he's going to use this in the shoes he wears at work, he may be wearing it at work and on the golf course and hiking. Neoprene is a good material. It's open cell. If you twist and move on it, it moves with your foot nicely, which would be great for golf and hiking. But I will go with the 1/16 instead of the 1/8 in order to make it easier to fit into dress shoes. If it was just for his golf shoe, we may look at the 1/8, or for his hiking boot. Bottom covers, again, to keep it nice and thin to fit in shoes well, we'll go with the vinyl. It's just a thin layer of vinyl that reinforces the forefoot. You could go with a cushion material if you knew you had lots of room in the shoe. Metatarsal pads. He has no metatarsal issues. We don't need those. Heel pads. He does have. We're going with a spur pad because he has a tenderness over the medial calcaneal tubercle, which is right in this area. The spur pad, you can see it outlined in blue here, will take pressure away from the middle part of the heel where those tubercles are. The heel cushion, okay, will give a general cushion throughout the heel, and is good if it's more non-specific or general heel discomfort, or if the pressure or tender area is around the edges. The heel cushion's a better idea. But when the tender area is in the middle, the best way to unload it with the heel pad is to use the heel spur pad. Do not need arch pads or scaphoid pads. Do not need those extensions or stabilizers, extensions. Rear foot posting, we're going to put a little posting in. He has mild rear foot varus deformities. He stands pronated in calcaneal valgum, so we will accommodate for that. This may or may not be necessary according to what you find on assessment, or you may want to go with a 1/8 on both. You may find that he has a deformity on one side, not the other. Usually, more often than not, you see if someone has a varus deformity that you'll see it on both sides. Forefoot posting, not needed as well. And remember, any of these with the asterisks, if you're not 100% confident that that's exactly what your patient needs, make sure you talk to me about it. They can cause you issues if used incorrectly. And a couple of them are very expensive, so you don't want to use them if you don't need them. I don't think I gave a shoe size, so we'll say he's a size 10, and that's how you put that orthotic together for a patient, for a typical plantar fasciitis patient. And then you can click add to cart and follow along to order the product. Thanks, and I hope that helps.